Video.
Thanks, Daryl. Yeah, and if everybody would put your name and organization in the chat, that would be wonderful. I hope everyone had a good weekend.
Mine was
short.
good. Busy.
Daryl, what'd you say?
I said it was too short.
Always. Well, we
2
got used
days.
to all this holiday time, so now
Yeah.
it seems weird.
I wish we got 3-day weekends because, doing chores over 2 days before you know it, Monday's back and you haven't really done anything.
That's very true.
Well, we do have a 3-day coming up this weekend.
That's true. Good point, Mark.
Hi, Christina. Good to see you. Hi, Namrata. Who else do I know on here?
Welcome, Mark.
Oh, Betty's on.
Yeah.
And Carolyn, I think I've met you virtually at some point.
Yep, about United Way.
Ah, yes, that's right. Well, now I've met all the other people that I haven't met before. So this is my first time here, Christina and Namrata, as you know. Thank you for inviting me. I hope you don't mind that I'm tuning in.
No, we're happy to have you, Mark. Thanks for joining. This is open to, we love to get everyone we can in the room, so that's wonderful.
Forward to learning more about you guys as well.
Hey, Namrata, we have a request. Read.ai meeting notes is requesting to record. I'm assuming that's from other people that are attending the meeting. Is that correct?
Correct. It's not from us. There's
So
another one.
I'd like to decline that just because it
Oh,
could interfere with our recordings like it did that one time.
okay. I can. So, a lot of people have a Read AI. I'm sorry, but we are going to record this meeting and we will be sharing at the end of the week, the whole recording and AI summary. Thank you.
We have too many Christines and Christinas on this call.
It was a popular name.
Well, actually, it's all Christinas. Okay.
Thanks everyone who's joined. If you don't mind, please put your name and organization or affiliation in the chat box. Great to see all of you.
So unfortunately, the Broncos didn't do it.
Yep, it did not happen.
But they did better than most people thought this year. So that's a positive.
Hey, we made the playoffs for the first time in a long time, so I felt good
Yep.
about it.
I thought they had a shot when the first possession and scored a touchdown. I was like, oh, okay, this might be a game after all.
Me too. Me too. I was so
Famous
hoping.
last words.
All right, we got next year, guys.
I'm sorry, this is more administration question I have really quick from Mike before we start. I do get a lot of people with the AI note taker. I have at least 6 people on the room. Mark. If I cancel that, do I cancel the person too?
No, it comes in as a separate kind of individual or participant, so you can cancel there. Cancel the AI participation.
I don't think it's coming like that, but okay. We'll see into it. Thank you, Mike.
Good morning.
Good morning. Good morning, all. Welcome. If you just joined us, if you'll please put your name and your organization in the chat, that'd be wonderful. Thank you. I think we'll just get started in just a few minutes and I'll hand it over to Sherry, but we'll give a little more time for people to roll in on a Monday.
I do miss working in Beaver Creek sometimes.
So, Christina, Garrett, this is a quarterly event.
Correct, Mark. This is a quarterly meeting that we have every quarter, obviously, and we do different topics and try to really just create a great place to have conversation. And this year we're going to be doing it slightly different. We're going to do virtual only, and then we're going to do some in-person only as well. So we'll see how that goes.
And it seems like a great opportunity for me to get to know more folks up in your neighborhood.
Absolutely, for sure. We're going to break into a smaller group today, so you also get to know some people through that. So, all right,
Cool.
Sherry, I guess we should begin just to keep track of everybody's time. And thank you so much. I'll throw it over to you.
Great, thanks. Well, Happy New Year, everyone. This is our first quarterly meeting of 2025. I'm excited to get the group growing. On the agenda, Christina has a great quote from Helen Keller, and I just think that's amazing. Alone, we can do so little, but together we can do so much. So thank you all very much for being part of this alliance, working together for the better health of our community. And I appreciate each one of you. So please do put your name and your organization in the chat if you have not already. And I'm going to hand it over to Christina, and she's going to give us some updates.
I have to unmute. Thanks, Sherry. I'm going to share some things about West Mountain and just kind of make that happen. I'm just wondering if you can put a thumbs up on your thing or your own thumbs up if anybody's brand new to the meeting. I know Mark is. Anyone else has not been here before? Okay. Christina, great. So those of you who are new, please follow up if you have any questions or thoughts. We appreciate that. And we're glad to have you here. All right, I'm going to share a quick presentation with all of you.
Christina, Kim has a hand raised if she has a quick question.
Okay, great.
I'm good. No, I'm good. Thank you.
Okay.
I was raising my hand for the other question. Sorry.
Oh, okay. Thanks, Kim. Nice to see you. All right. Thanks for coming today for our quarterly. I think there's going to be lots of good information. We're excited to have our the civic partners with us today as well. I think you guys all received the agenda, but I'll just go over it really briefly so that everybody knows what's expected. We're going to get a quick update on West Mountain, and then we're going to have Berta Rivera, who works with us, talk about the resource guide. She's done an awesome job on that. And then we're going to have the Civic, which is the Center for Improving Value in Healthcare, present about the population health data dashboard and the in-kind project we're doing with them. We're going to have some focus groups to really talk through some of the things and get your thoughts on what should be included in that dashboard. Then we're going to do some quick report outs, and then we will conclude for the day. So, we're hoping this is really interactive when we get into the resource section or into the group section, because I think that's going to be a great opportunity for everyone to have some really good conversation. West Mountain Board started with a presentation in December, and we wanted to bring it to the larger group because we feel it's very valuable for us to all work together on this. So I wanted to share a photo of some of our team. I'm going to be sharing a little bit of an update on some personnel changes. And so this was for an event that we held for WMRHA. And so just wanted to share that because pictures are always fun. So staff updates. So WMRHA is going to be stepping out as the Health Access Director. She gave us a lot of lead time, which I greatly appreciate. So we'll be talking more about that in just a moment, but she is going to come back in March and support Mountain Coalition for Food and Nutrition Security and another program, PCORI. So we're excited. We're sad that she's leaving, but excited that she'll still be involved on a part-time basis. So we'll talk more. I'd like to welcome Karina Rasmussen. She is our Housing Access Data Coordinator. Karina, raise your hand and say hello.
Hello, everyone.
We're really glad to have her in this role. I think she's really stepping into it and doing well. As you know, Keith may share from VAH's perspective. They've done a lot of systems and data shifting, and so that's really exciting. I'd also like to welcome Cindy Blatchley, and she's our new administrative coordinator. Some of you may know her from other nonprofits that she's worked with here in the Valley, and I am extremely happy she's here. I think all of us are. She's offering a lot of support and just really great to have. Cindy, will you say hello?
Good morning, everybody. Nice to see you all.
Yeah, and last but not least, I wanted to share that Keith Berglund has accepted he has accepted a new role as deputy director. And so he will still be handling the housing access, moving more into some of the leadership, but also working in internal work here in West Mountain and some, joining the leadership team. So Keith, say hello. Congratulations.
Hi, everybody. Thanks.
Again, WMRHA and I have been doing this work together for 8 years. And so I just really wanted to take a moment and thank her for her partnership and just the work that she has done to make West Mountain a success. And so this photo was from way back when we presented to the Health Resource Services Administration, when we had a grant through that. And, we started out really tiny with the two of us, and over the years we have grown, and now we have, a much fuller staff. And, yeah, so I don't want to cry, so I'm not going to get too far into it, but I wanted to share a couple other photos. Another photo, I think WMRHA's talent has always been connecting and building relationships. I know a lot of you in this room have spent time with her, and I just love that she brings enthusiasm and just really creates a great environment. And so I want to say thank you, WMRHA, and so grateful for all that you have done. Thank you. Let's give her a round of applause. WMRHA, do you want to share just briefly with the group?
Yeah. Thank you, Christina. I had a wonderful journey in West Mountain for the last 8 years. On my farewell day, I was telling everybody I didn't cry because I had a good chunk of a time to go through all these emotions. But thank you, everybody. Everybody in this room actually has helped me to grow, and I really, really appreciate all of my time with you guys. Um, but I'll see you in different journey. Thank you.
Thank you. Now I'm going to pass it on to Keith just to talk briefly about some of the great things that have happened in 2024 with the Valley Alliance to End Homelessness, and just share a few highlights. And we just want to thank our awesome partners.
Sure. Thanks, Christina. Really an impressive year. My first full year working with the VAH, and we've achieved a lot. And of course, we've taken on even more to make things even better. One thing the group has done with a lot of great work that actually probably started in 2023 was achieving the designation of quality data through Built for Zero. It's a lot of background work of cleaning up databases and processes so that we can make sure the numbers that we have when we're looking at people experiencing homelessness are as accurate as possible and give the best information for what interventions we can take. Sort of in the second half of 2024, we've been sort of working on the case conference process, trying to make it more efficient, honoring everybody's time, but also make sure we're connecting with the information about every individual that's on the list, making sure that the right people are on the list and they're getting the services or the opportunity for the services that they need, as well as making sure there's nobody on the list that isn't on there anymore, that isn't currently experiencing homelessness. We've also launched, well, continued, sort of trickled into, but it's becoming, sort of a concrete work that we're doing with the newcomer support task force. We started in fall of 23 with the arrival of folks from Venezuela here in Carbondale, and their needs are continuing to be front on our radar, and so we've formed a group that's sort of organizing itself and then figure out some of the things we can do next to support that population. You've already met Karina quickly. She came on at sort of the end of the summer as our housing access data coordinator. And I want to pass it over to her and give her a chance to share some data from 2024, some just high level sort of summary stuff on the work that we've been doing. Karina?
Yeah, let me work on sharing my screen real quick. Everyone able to see these graphs okay? Okay, perfect. So this is just the outflow by year, and outflow breaks down into housed, moved into other destinations, or moved into inactive. And we have it broken down by county. We can see some big successes in October. In Eagle, they have about 8 unique individuals. In Garfield County, it looks like April, we had about 12. And then in Pitkin, we had a high of about 6 in May. And so that's just kind of a little bit of the data we've collected about some individuals we've housed.
Okay, I'm listening to a meeting, but
is there any other questions at this time?
All right. Thanks, Karina. I appreciate it. Looking up those charts really quickly. Thanks. Back to you, Christina.
Great, thank you. Let me reshare. Can you guys see that full screen now? Okay, thank you. I didn't realize it wasn't. It's hard to tell when you're on 2 screens. So let's see if I can. All right, I'm now going to pass it to Namrata to talk about the Mountain Coalition for Food and Nutrition Security and some of the great work that they are doing.
Thank you, Christina. You're already forgetting my name. Just kidding. So with McFinn's, we just finished our a quick gap analysis that we had on December 7th. At this time, Pickens County GIS team and Pickens County with McFins, we're working on doing a gap analysis. What that is we have about 25 programs around food. That includes government program, all the Food Bank of Rockies, Lift Up, everybody, Eagle Valley Community Foundation, school program. It includes all of that. So when we have that map ready, we will be able to see where each resources is available as per population density and transportation. So CM is doing a wonderful job on head spearing that as a program and service committee from McFins. And that's something that will have a tangible result to share with the partners. Beside that, we have two other committees who are working diligently towards the goal. The community engagement are working around the resource, putting the understanding what other resources are in the valley, and they're also working on the goals that we have right here in the screen. The community engage works on 2 of these goals, and funding group is pause at this time because we are trying to pull out all the gaps that we're going to work on. Then funding group will be working on that budget on who to reach out to around what funding. So that's something that we are working with McFins right now. Thank you, Christina.
Thank you, Namrata. And I do want to say, I got to see just a little bit of the gaps analysis and the work that's gone behind that, and it's going to be exciting to share that. And then the group will be working on different ways they can address some of those gaps, which is really awesome. So thanks to all of our housing and homeless partners and all our food partners. This work happens because of all of you. And it's so important because we're seeing continual increases in food insecurity and housing needs. I just saw a article recently that the study was done, and across the country, both of these things continue to be on the rise. All right, so I just wanted to share briefly about sort of what the West Mountains 2025 focus is. So we're wanting to continue to build upon the successes that we're experiencing with our partners and with all of you. Our annual report will be out in this spring, and so look for that. That'll talk about some of the things, even deeper into some of the things that have happened. We really want to do a lot around telling the story. Working with partners to tell the story of the amazing work. This will be really important to be able to move us forward with being able to continue the work through having, the funding and enough staff to make things happen. And I think it's going to be even more important in the next few years. And then creating system improvements and all of those things with partner organizations is key. That's one reason we're working with Civic around data visualization and wanting all of you to get involved with that. And so we'll learn a lot about that today and welcome any questions. Any questions from this point or comments that you guys have? All right. Don't be shy. Finally, really excited. Berta, congratulations on this. The resource guide is actually the print copies are going to be around soon. This PDF will be available, and it is more than 300 different resources around social determinants of health. And so I wanted to thank Berta for all her work on this. This was her work for the past year plus, and she really did a great job. And so I'm gonna pass it on to her, and she's gonna share more clearly about what's happening with the resource guide and give you guys more information. Thanks, Berta.
Hey, hello everyone. Give me a second to just share my screen.
Okay. I hope everyone can see that. Since I'm presenting, I can't really see. But like Christina said, we're just really excited to finally launch the resource guide of 2025. Just a little bit of information on it. So it is the collection of all community resources from across 3 counties, Pickens, Garfield, and Eagle. As of now, there's 150 different community resources on the community or the resource guide. It contains 13 different resource categories. So that ranges from like food, housing, transportation, health, whatever you can think of, can go into that resource category. So this is kind of pretty much just the beginning. This is the first resource guide that's being put out. So the thought is, to continue to build on it. So this is pretty much like the first kind of tip of the iceberg of all the community resources we have available in our Tri-County area. The goal of the resource guide is to help reduce barriers and access to help our community navigate the system, specifically providing this resource to caseworkers, resource navigators, anyone who works with clients that might just need an extra help just to figure out what are the resources out there and what's available to their clients or patients. The PDF is 72 pages long. So just a little bit of disclaimer, just so if you are going to print it, just so you're aware and you know how long it is. You can find the PDF on that website later after the presentation. I will also put it under the chat if you just want to click on it. This is the cover of the resource guide. That QR code does go to the resource directory, which is the online version for the most updated resources. So just wanted to go through all of the printed and online materials that are available for y'all. So on top of the PDF, which right now is only in English, but the Spanish PDF will be available in the same location in February. There's also resource directory, which is again the online version. I know it's a little confusing with resource directory, resource guide, but there's posters, flyers in English and in Spanish that you can, print. If you want to, put it out on your organization just for clients or patients to be able to see and utilize. And then just to go through some of the features, the guide will be something that's going to be printed and offered annually. And the resource directory is going to be updated quarterly. All of the updates that we receive are shared with CRN, so that's also going to be updated on their guide as well. And then just real quick, just some of kind of just the partnership asks are, if you have any feedback on either or the guide or the directory, please share that with us. Like I said, this is kind of the first additions, so we really want to just continue to get better on it. And then share with your clients, share with your patients, share with the community. We really do want to get this out there to the people who would utilize it or need it, and encourage other organizations to get involved if you don't see them on there, just to get their listing up there and the resources that they offer. If you have any questions on who you contact, that's me. So if you do want some of like the printed materials, West Mountain does have some available. Right now for the resource guide, we will have 150 copies in English and 50 in Spanish. We do also have quite a bit of some of the flyers and posters for the resource directory, which are in English and Spanish. So if you would like any, just shoot me an email and I'd be more than happy to give that to you. If you want to update or add a listing, also just contact me with the information and I will get on that for any questions or concerns. Yeah, I'm your person. There's my contact information, and I will also put my email on the chat as well. But if anyone has any questions, I'm more than happy to answer them.
Hey, Berta, can I ask a clarifying question?
Yeah.
The QR code, is that just the English version, or is there a QR code for English and Spanish currently available?
So the QR code, that's only for the online resource directory. So it takes you directly to there. There's the option for the Spanish up on the top right. So that's in English and in Spanish.
Okay. In the
yeah.
directory, right? So QR code will take them to the directory, then they can choose English or Spanish.
Yeah.
Awesome. Great. Thank you
Yeah,
very much.
thanks. Any other questions?
Can I add a little bit, Berta, if that's okay, a
Yeah.
little bit background, because some people in the room might be a new one. A couple years ago, Westmount Pickens County created this resource guide. It was created by Mari and then Westmount team and the Pickens County. At that point, it was a very good result from the team. That's why a lot of providers reach out to us about, can you add more? And that's why Berta's whole project became to make a new resource make a resource guide with a lot more additional information. So I just want to give a background that where did the resource guide come from? It was the community need that community asked for. So thank you.
Well, I just, again, want to applaud Berta for her efforts and all her work on this. And I think it's going to be very helpful for all of you in the room, and also to share with clients who might be looking for different resources. So in the online directory, you can, if you're looking for housing, you can look at those particular resources, or you can look for food, or you can look for mental health. And so it's pretty comprehensive and really exciting. So thank you, Berta. And
Yeah, and actually, just one other quick thing. All of the resources that you see on there, those are just the ones that we've gotten thus far. It is non-limiting, so if there is a resource that you offer that doesn't fall under one of those categories, we are able to add on to it.
very good. Thank you so much. Before we introduce our civic folks, any other questions or thoughts before we go into the presentation? All right. Awesome. Thanks, everybody. All right. So first I want to introduce Darcy Holiday Ford. Darcy, are you on here? I can't see all the people. If you're talking, we can't hear you.
You just was having a struggle with the mute button. Can you
Understood.
and can you see my screen?
Yeah, if you want to put it in slideshow mode right now, we see it. So up to you. There you go. Perfect. Thanks, Darcy. And if you'll introduce your team too, that would be wonderful.
Yes, I will. Thanks so much, Christina. And I'm so excited to be able to join in on this conversation after the presentations from the different work groups and alliance resources. I think it's really impactful and really in line with our discussion today about social determinants of health and our work in partnership with the West Mountain Regional Health Alliance. So just a little bit of background on me and my team. So my name is Darcy Holiday Ford. I'm the Director of Research. So I oversee our internal Center for Improving Value in Healthcare research agenda. So most of that right now is around end of life and maternal work, as well as our program evaluation work. So we, in this arm, we partner with different organizations across the state to be able to support evaluation, different ways that we can leverage both the all-payer claims database that we're the steward of, as well as other data sources to help data literacy and support community movements. So that's really in line with what this project's about. Megha Jha is one of our senior research and evaluation analysts. She works on both arms of the department of our research, partnership, and innovation, both doing research and publication as well as program evaluation. And then Rachel Jarjim is one of our evaluation analysts, and she has a really big passion in epidemiology as well as public health. And so brings her experience with working in Jefferson County Public Health to our evaluation work, as well as this work here with West Mountain. So just a little bit of the background, like Christina had mentioned, we're going to hopefully have a good part of this presentation be interactive. So we'll do breakout groups towards the end of this, but we just wanted to give a little bit of background on us as Civic and the all-payer claims database, as well as this partnership and ways in which we would be able to love to get your insights on social determinants of health and ways that we could measure that in the community. So we will go through a couple of our dashboards. One is the health equity dashboard, as well as our community health dashboard. These are two of our biggest dashboards people often utilize, and Rachel will go in more detail around that. And then we wanted to also go through, we have at the sort of wrap up a survey of data sources that any and all of you might be able to tell us about, so we can understand when we're looking at social determinants of health across West Mountain and the Alliance, different ways that we might be able to measure and understand that from what's already currently collected. So a little bit about who we are. So Civic is Center for Improving Value in Healthcare. We are a nonprofit, independent, objective, and service-oriented organization. We partner with a variety of organizations across the state within our mission of equipping partners and communities in Colorado and across the nation with resources, service, and bias data to need to improve health and healthcare. So both through our partnership as well as our administration of the all-payer claims database. So let's go a little bit into some of that. What is the all-payer claims database? Just like it sort of says, it's collecting all payers of all different healthcares across Colorado, across time. So what we have are from claims that started in 2012, our claims get really pretty good in 2013, and they follow individuals across all of their healthcare, inpatient, outpatient, if they're going to urgent care, all the way through all their different payers through that period of time. So it's a really good longitudinal data source to be able to see impact, and it's a really great resource for program evaluation with that. We have 1.5 billion claims throughout that we have about halfway through 2024 as well. We have all commercial payers, as well as Medicaid, Medicare Advantage, and fee-for-service. We also have about 1 million lives of individuals that we call RISA plans, so employer-sponsored plans, about 50% of those. It covers 74% of all covered lives in Colorado. So anyone that has health insurance over that period of time, about 74% of those individuals. So quite a lot of people. It's about 5.5 million people up to date. What we don't have in the all-payer claims database are, we don't have uninsured or self-paid plans. And we don't have the 50% of self-insured small employer plans or federal programs. But throughout that, we can get a good idea about health insights, what kind of utilization is happening, who's using it by demographics and information around enrollment, as well as information about geography and all of those levels of care. So if anyone has any claims for those payers within that area, we collect that information. And how we use this information is kind of a twofold. One is we have public available data. So the two dashboards that Rachel will go through are examples of these public data. So we really have a lot of information, one that you can locate via our website, as well as information that you can download. You can download actually the aggregated data sets that are involved in these dashboards, just putting in your information and being able to download it. What you'll also notice when you download that information is that there's more breakdowns than you see within the dashboard by age groups and race and ethnicity. It just gets a lot to be able to see all those measures within those dashboards. And we also do non-public APCD data. So those are ones that we either license out to researchers to do their own research, or some of our other analysis that are not publicly available. A lot of our research and evaluation work is in that umbrella, as well as our community engagement. And that's really our department, which is the research and evaluation department, is really to use either APCD or non-APCD data and really understand health equity within the Colorado landscape. I'm going to pass this over to my colleague Rachel so she can go through one of our two dashboards that we will highlight today.
Thanks so much, Darcy. Yeah, so as Darcy mentioned, my name is Rachel Jarjim, and I work on our evaluation team. And I would be excited to go over two of our dashboards with you all today. So I believe Miga is going to drop the links to these dashboards in the chat. But the first dashboard I want to talk to you about is our health equity dashboard. So as Darcy mentioned, these are all publicly available data. And I think it's a really great way to see some of the awesome analyses happening at Civic and with APCD data without a price wall. So I'd invite you all to follow those links that Mika just dropped and explore this with me. So if you're going from the general Civic website, you can always navigate from civic.org to get data, public data, and then we have a variety of featured focus areas, one of which is our health equity analysis. And this dashboard really answers the question, how are social factors related to healthcare use? So it's designed to give decision makers insight about how to address health inequities in their own communities by showing the relationship between key social factors and the use, access, and quality of healthcare services in Colorado communities. And the way that we're able to do this is that the data in the all payer claims database is geocoded, which is kind of a fancy way of saying it pinpoints every individual member or individual's address. So using that, we can link with other outside data sources to gain insights into specific communities. In this specific dashboard links to census tract data in the American Community Survey, and it also leverages the CDC Social Vulnerability Index, which gives information about things like income, education, employment, housing, transportation, race, ethnicity, and language. So going through this report a little bit, on the main page of all of our reports, you will see a description of how to use the report and why it's important. And kind of the key metric for this report is an R value, which is a correlation value. And that value shows the strength of a relationship between two variables. So the higher the R value, the stronger the relationship between two variables. So I'd invite you all to look at the relationship, explore between preventable emergency department visits and income level. And if you're poking along with me, you might notice that this specific relationship, it appears like there's a really high correlation between these two measures on a state level. But then drilling down to some of the counties that West Mountain works in, so Eagle, Garfield, and Pitkin counties, you might notice that the relationship is not nearly as strong. And this is not uncommon. So sometimes individual counties in Colorado have different results than the state as a whole. And that's why we really think it's important to be able to drill down to those county levels. Similarly, if you select percent unemployed and potentially preventable emergency department visits, you might notice that there's no relationship for Garfield and Eagle County, but there's actually a strong relationship in Pitkin County. So this might indicate something that West Mountain wants to explore further. And we're really excited to hear from everyone on the call today, how it might be beneficial to cluster some of these counties and what outcomes you're interested in looking at. Darcy, you can advance. So the next dashboard I want to chat with you all about is our community dashboard. And this dashboard is just really incredible. It's kind of a compilation of the metrics that Civic uses most frequently. And it's really designed for decision makers like everyone here on the call today, to be able to go through and explore metrics on a DOI region and on a county level. And as Darcy mentioned, again, all of this data, the background data, you can download it and explore it on your own. And we'll show you how to do that. So all of these metrics on this main page of the community dashboard have specific methodologies, and Civic always tries to be really transparent about how we calculate these measures. So you can explore and ask questions. The overview and definitions page will go over all of these measures. And then if you advance to the right, the snapshot we've got showing here is the regional and county profiles. And that gives you, again, that geographically specific information. So West Mountain, you would be in the West DOI region. And you can explore either by DOI region or by county. And this dashboard is frequently updated, but for the most up-to-date data or most complete data that has from all payers, you might want to select 2020 and explore along with me. So the cost, quality, and utilization tabs also display a subset of these measures. So that county page is kind of like an overview. And then the cost and quality and utilization on the right will show just a breakdown of some specifics. But on the whole, you can see a summary of your selected county and region. And what's really cool about this page is that it gives you a state baseline as a comparison. So you might notice these orange and green arrows. Those arrows indicate whether or not the value is higher or lower than the statewide baseline. The color of the arrow indicates whether that the county is faring better or poorer compared to the state baseline. So green indicates that the county is faring better, and that orange indicates that it's faring poorer. As a reminder, Civic, this is all publicly available data, so we do follow CMS suppression guidelines. So you won't find any values less than 11 displayed on this page. But you can explore on your own. And as I mentioned, download all of this data and explore on your own time. So we're really excited that this is all publicly available, free of cost. And we hope that it's helpful for you.
Thanks, Rachel, for going through a couple of our publicly available dashboards. I think it's helpful to kind of come into this conversation about this project, our partnership between Center for Improving Value in Healthcare and West Mountain Healthcare Alliance, to be able to see some of the background in which we're coming to this program, as well as different ways that we might be able to visualize social determinants of health and progress in social determinants of health for the West Mountain region. So let's go into this a little bit. So the three counties that we're looking at, and we've started this conversation back in June with Mike and Christina on ways that we might be able to actualize the strategic goal of West Mountain to be able to measure and visualize social determinants of health across these three regions. So Eagle, Garfield, and Pickens counties. And within that conversation, kind of highlighting some of the priority areas that were discussed and identified across the Alliance from previous discussions, which was housing, food insecurity, transportation, cost of living, and mental health. And the challenge with this, being able to understand and be able to visualize social determinants of health and progress in any of the work groups or different coalitions that are working on some of these issues, is to be able to track it in real time and be able to see progress within these coalitions or within these focus areas, so that everyone across the Alliance could have information to guide their decision and have actionable results. So that's how we came together of saying, how can we support you to be able to, one, either take in different data sources and be able to visualize this, or utilize the APCD to be able to support this analysis. So the scope of this project really is to help facilitate a couple of these conversations, one with the board and one with you all here today at the quarterly meeting, to be able to see and take an inventory of different data sources that the Alliance is currently using, and different ones that they might be interested in potentially supporting understanding of social determinants of health. And then to create a mock-up of a dashboard to be able to have a few key measures that the Alliance across the board feels like would be a powerful place to start. So that's our charge, is to be able to understand what those social determinants of health measures would be based on your input, as well as different ways that we might be able to answer those questions with different data sources. Just a little bit of the timeline, just high level here. We initiated a contract with Westmount back in September. We were able to secure funding for this project through the Health Equity Fund, which is a collaboration between Civic and CHF, the Community Health Foundation, or Colorado Health Foundation. That was back in September, kind of October area. And then we did a presentation for the board back in December, and then our presentation here today for the quarterly meeting. Our hope is to be able to develop some draft measures for the Alliance by the 1st of March. And then within that, visualizing what that draft wireframe of the dashboard would look like by the end of mid-June or so. And by the end of September, to have a finalized wireframe of that dashboard so that we can see what would be the places that we would visualize those social determinants of health. And we love any of your feedback as well. Our two main contacts are going to be Mike and Christina, and I'm sure several of you will be a part of that. And that's where you kind of fall in today, which is understanding kind of this progression in ways that you can offer feedback. So we went into here understanding what those needs are. So needs of transportation, cost of living, your food and nutrition, housing, and then mental health. And we hope to be able to prioritize those sort of focus areas today and be able to say, how would we know whether or not there's success or ways that we can measure these social determinants of health? And then finally, to develop what that dashboard might look like based on a couple of options. If it's an APCD dashboard, if we create a wireframe of different data sources that the Alliance is collecting, or we are guided by another dashboard that one of you all are using for being able to measure social determinants of health across the Alliance. So I'm going to pass it over to Rachel. She'll give you a little bit of background about health measures and ways that we can understand it, and as well as kind of kick off our facilitated discussion.
Thanks, Darcy. Yeah, so we're really excited to have a facilitated discussion with you all today in just a moment. But before we get started, we wanted to give you some ideas so you could start brainstorming on what measures might be important or insightful for your specific regions and counties. So here we've got just a list. When we talk about measures, we're really trying to get specific and then think about things that we might already collect in the community from various data sources that might inform, as Darcy said, our decision making and our understanding of if we're progressing in our efforts to improve certain health metrics in our communities. So here you can see an example, some examples of health measures we think about often in the CUAPCD. One of my favorite ones that we use is a 30-day hospital readmission rate per 100,000 residents. And then you can think about all of these measures as well, breaking them down by specific races and ethnicities, or if there's other specific measures in the community that you find insightful. These also might look very similar to measures that you use in your community health assessments. Darcy, you can advance the slide. Here's just another list of some. The CUAPCD also has some amazing measures that aren't available by many other data sources. So looking here, I'm just picking out a couple that we might be able to glean using all-payer claims data would be things like mental health provider density per county, or rates of depression and anxiety diagnoses per county. Those are things that might not be readily available through other data sources in the county, but we do have in the Colorado All-Payer Claims database, which is really exciting. You can advance the slide. So just an example, as we touched on already, mental health, kind of moving from what is our question to what is a measure that's actually insightful. Here we have a question. Your question might be something like, what percentage of adults in each county experience prolonged mental health challenges, which you're defining as 14 or more days of poor mental health per month. So defining that measure, getting really specific about what we're actually looking at. And then our charge would be to identify a data source where you might be able to find that information. And this is just a mock visualization of how you might compare the counties that West Mountain works in on that specific measure. And we have another example as well pertaining to nutrition. So another example of a question you all might be asking is, how easy is it for residents to reach food pantries in each county? So a measure you might select is the number of food pantries per county, which we could obtain from Google Maps, and then we could map it and calculate the number of pantries per county and do a comparison to see how access might vary. So moving on, we've got some really wonderful questions we're hoping to chat with you all today. And we have various group leaders who are going to help facilitate these rounds. But really what we're hoping is just to kind of break into smaller groups and hear some of your personal insights. We'd love to help field any questions you might have about the partnership between Civic and West Mountain. And then talk about what specific social determinants of health you think are really necessary to have a look at to get a comprehensive picture of what's happening in your region. And if there's any social determinant of health information that would help to support that decision making. So I will pass it over, I believe, Christina or Mike. Someone's going to help break us out into breakout rooms, and it will be each one of the leaders here will be in the room to help field some of these questions. Yeah, so I think
Thanks,
room
Rachel.
should.
Any questions before we do head into our breakout discussion, which will last about 30 minutes in groups of 10?
Just wondering if if Mike or Namrata, can you post the questions in the chat so we can copy them into our breakout room?
Yeah, Namrata, could you do that?
Awesome, thank you.
Any other questions before we do that? Okay. We have 6 groups with about 10 people in each room. And due to not being able to attend one of those groups because I'm the host and also Namrata is, we have you, Berta, in room 3, if you could facilitate through those questions in the group. So I'm going to open up all the rooms.
So I do see one question before we jump in. Sorry, Mike. So Melina asked, so data about undocumented is not included, right? Can you, Darcy or Rachel, answer that?
The question about whether or not undocumented is in the APCD, is that the question?
I believe so, but Melina, if you need more specifics, let us know.
So we have within the APCD, everyone that has, so if it's an individual plan, I know that there's some special plans within the Denver health system that are specifically for immigrants that are a smaller population. So we don't have like demographic information about whether or not if someone is a citizen or not a citizen, or if they're documented or not. We get it on the claim side from the provider. And from the payer, that just indicates this person has this type of insurance. Here's their demographics, meaning age, their location, what city they're located, where the services were, and information of that sort. We don't have information about someone's immigration status, outside of if they have visa and they have health insurance through an employer or through the exchange, we would have that information, or through the Denver health system. I hope that answers your question.
Thank you. All right, we're gonna break out. Thanks, Mike and Namrata.
Here we go.
Mike? Mike, can you hear me?
Yep. Go ahead.
I'm a host. If I go, everything goes away. So do I make you a host first?
Yes.
Okay, and then you want me to log out and come in, correct?
Correct.
Okay. Who's facilitating? Berta, are you facilitating that room? Oh, she's gone. Okay. So I'm not facilitating, is that correct?
Hold on. I have you again. And yeah, if you can jump in room 3.
Welcome.
Thanks for not putting me in one because I have to jump off early, so I appreciate it.
You're welcome.
I'm
Thanks,
gonna put a
Jean.
chat just to thank everyone for their time today because I won't be here when everybody gets back. But just wanted to let you know, thank you guys so much for what you do. I appreciate it.
Thanks. All right, Namrata, you can join room 3 now. And I'm going to move one person over to room 1. We lost a lot of people when that happened. Hey, Aaron, can you hear me?
Can you see my screen?
We can. Perfect.
Perfect. And I think we could probably popcorn it. I know what group I was in, so I can volunteer Dustin to report out on what we talked about. We had a really lively discussion, and I think we were able to cover a lot of ground, and I'm really interested to hear, you know, how that overlays with everybody else's experience.
Thanks, Darcy. I'll just briefly share out what our group talks about. I think the main point was cost of living and how it impacts each of the areas that we're talking about, whether it's social determinants of health, housing, or transportation. But the main area that we focused in on was access to coverage and cost of care. We know that Medicaid eligibility is capped at 135% or so of FPL. And when folks out in our communities are working, that usually drives them out of Medicaid eligibility. But they're not earning enough to afford a plan on the exchange, or maybe their employer doesn't sponsor coverage. And so that drives a lot of the challenges that we see in our community. I think the other thing I would just briefly mention is the CRN network, so social determinants of health screening and referrals seems to be doing its intended or having its intended impact, where folks are identifying folks that could use a social determinants of health resource, and those referrals are being made. So I think I'll leave it there. Oh, no, I won't. One more thing. The one curiosity that I had, I know I've talked to some folks on this call, is just the challenge in understanding the coverage dynamics in the state, in our region, I should say. We all kind of know a little bit based on our own experience, but the data that's available doesn't always paint a timely or complete picture. So curious if there's an opportunity for this group just to identify new data sources or share data in a way that allows us to all understand the kind of coverage challenges and trends that we see in our communities.
Thank you so much, Dustin. I think that was a really great summary. I'm assuming you were breakout group number 1. Is that correct?
I think that's right. Yeah.
Okay. Do we have any volunteers from breakout room number 2 to kind of piggyback on that and share some of what you all talked about?
I'll jump in, and hopefully I'll open up for the folks that I was in the room with on that team to jump in, and if I leave out a point or don't describe something exactly. So we started with just adding, I think a lot of the things that Dustin just mentioned, we mentioned in terms of what are the data points, or what are the areas or the social terms of health that we want included. I think the same for everybody: housing, transportation, food, access to food and nutrition. They also listed financial issues and personal safety. We had a good discussion about even expanding those ideas out to reproductive care and support, and culturally affirming support versus mental health, physical health, things like that are appropriate for everybody. Clothing, especially for children, having the right supplies to be healthy, and language issues, language barriers, addressing those and how those affect people's health, as well as legal issues. One of our members, Matt, shared with us, and actually it was echoed by some others. This is part of the CRN tracking the referrals made, identifying the need. Is there support to help the individual with that need? Did the connection take place? Was the service available? Did the connection to that service become available? And what was the outcome? Were there any improvements there? Becky mentioned that that's already part of what CRN does, and we acknowledge that sometimes those referrals or those conversations about making referrals happen organically, as a side conversation at a meeting, or two people are from two different agencies are meeting together for another purpose. And those don't always go through the network where they can be tracked and followed. So making sure that information is there, collected, but also is the system already there for collecting it, and how do we get into the habit of using it? The effects of school-based mental health as a point, is it available? And this would be challenging to track, but what are the ongoing or the longitudinal effects of that in terms of school success, graduation, mental health improvements, decreases in discipline issues, and decreases in expulsions and suspensions, and then even beyond that into the workforce and into adulthood. What are the effects, and can we compare those and see what those data points are? That's a big one. Longitudinal stuff is a big one. Anybody from that group have anything else to add that I forgot or didn't fully express? All right. Okay. Room 2, that's us. Done.
Thank you so much, Keith. I really appreciate all of those insights. It's always fascinating to me that was like a completely different train of thought than some of the people had in my group and where we went with our discussion. So thank you so much for sharing. Anyone from group 3 want to share out?
Yeah, sure. I'll share. Jared Rollins. So our group agreed with all those main categories there, but also as some of those more nuanced things, like we all agree that housing, food security, transportation, mental health, cost of living were important. But drilling down into what some of those categories are, some subcategories, was something that was important. Understanding the household size was really important to this group, as well as the average income, as Dustin was sharing, like just because somebody qualifies for some of these services federally doesn't mean, or their cost of their income is higher than what would be qualifying them. A question of should we have physical health data in there as well? How like some physical health data relates to these social determinants of health would be interesting as well. And then also this comparison of like systems level data. So specifically for mental health, who's providing the care? One of our main issues and need in mental health is that we have a lot of therapists in here in this area, but a lot of them are private and don't take insurance. So you're missing a big chunk of claims, or you're missing a big chunk of that just by focusing on claims data. So how you can capture those folks, and then really having like an outcomes lens here. So there is some pipeline work going with mental health providers, but how do we know that those programs are making an impact for mental health and substance use? Yeah, anything I missed from other group 3 members?
You did great. Thank you.
Yeah, great. Thank you, Jay.
Thank you so much, Jared. Love some of that mental health discussion. I think that's very insightful. Yeah. Anyone from group 4 want to share out?
I think we're 4. I'll share, but then I asked a couple other people to fill in where I may have missed it. But we talked about obviously the same thing. Those are very important. Bringing up though, calling out like the substance use disorder thing, and really how some of these unhoused and other folks have multifaceted needs and how you represent that. We also talked a little bit about the importance of the senior population, but in general, thinking about social connection and loneliness and how that's impacting our communities. The other was around access to healthcare, and specifically for are migrants and undocumented. And so there's a lot of concern with changing in administration around sharing any personal information. And so how that's going to impact our communities. I think thinking about housing in different ways, we know there's many pieces of housing that need to be shown that impact, whether it's from workforce all the way down to those who are experiencing homelessness. Other is these are all critical, so but then thinking about how do we narrow it so that we're clear about who the dashboard is for, how is it going to be used on a regular basis, what decisions will be made. So there's some processing that needs to happen around that. And finally, an interest in going even more micro into like what's the difference being rural resort communities. It can be very different from one end of a valley to another. And so is there ways to slice some of that data? Jeff or Braulio, anything I missed or things you would add?
Yeah, I would say just how the data is presented, in what format. Is it just data in a spreadsheet or data as a presentation, or will it be stories that align with the data with some anecdotal information or some stories from clients that have received the supports from all these different programs that show the benefits, or the difficulties in obtaining. So just some data that is not just, numbers on paper, but, some stories associated or attached to it, that could definitely have more impact.
Yeah, thank you so much, Braulio. That's I love mixed methods research, and I would be very excited to see some qualitative stories alongside these data. So thanks for highlighting that. Karina, do you want to share out for our group? I think we're last.
Yeah. So for group 5, we mentioned some of those, as well as including as many data sources as possible. We had mentioned the number of households that are spending 30% or more of income on housing, as well as Eagle County pointed out that their households 39% or more are paying 30% or more of their annual income on households. We'd like to figure out more on access type measures, need for home health, uninsured and underinsured. And then we talked more about age breakdown, including age groups across the entire life cycle. So yeah, and then as well mention the need for LGBTQIA+ and families with disabilities. Some more information on them as well.
Perfect. Thank you so much for sharing back. Is there anything anyone else wanted to jump in or ask questions about?
Yeah, so we were group 6, and I forgot to ask anybody to take notes. So please, whoever a part of group 6, let me know. So I have summary notes. So we first of all introduce ourselves to figure out which side of the healthcare or the alliance team we work on. So we had a wide variety of team, and there were certain questions which were raised around, of course, social determinants of health, transportation, housing, and food security. We did talk about health disparity in length a little bit. We also talked about low to middle income families where they are underinsured and what happens to them, how they're utilizing the healthcare needs. I did talk in length about different public reports which we have available on our website, and how they have changed over time, like how telehealth analysis was focused, but then providers and stakeholders needed mental health focused telehealth services analysis. So I kind of walked them to my team. He also spoke about how different external data source, which can be collaborated with Civic's data source or CAPCD to come up with a solution. So I did that using our social health equity dashboard. We did have some questions around different like mental health, different health measures which are not available on Civic website. If Civic can do, so I walk them like we have custom reports for other projects. So if the alliance decide on certain measures and how visualization, how they want to see data as, what are the end audience would be like, we can cater to that and periodically update and change methodology as in what is required by the alliance. Yeah, these were some questions. Please, group 6, if I have missed anything, let me know. So yeah.
Thank you so much, Mika. Was group 6 the last one? I'm sorry, I was forgetting we had 6.
I think so.
Yeah, just 6 is the total.
Okay, perfect. Yeah, so Darcy, do you want to advance to the next slide?
Yep, hold on, it's frozen real quick. Let me just reshare. Okay.
Perfect. So for our follow-up survey, we would love to hear from you also. I know we had lots of conversation about different social determinants of health today, hopefully identifying some measures that would be really useful for you and your communities. One of the things that we identified early on would be helpful for the Alliance was having a list of data sources that are available pertaining to your regions. So this is it's a pretty quick survey. It's intended to collect data so you don't have to enter data on all of the data sources you know are available. Rather, if you or your organization that you're representing today manages a data source, we would love to know about it. So Darcy, maybe once this is over, you can copy that link from the dash and we can drop it in the chat. Oh, thank you so much, Mika. It should be pretty quick, but if anyone has any challenges with it, please let us know. We would love if you would take a few minutes to do that today before the end of the meeting. Yeah, and I will hand it back to Darcy to wrap us up.
Great. Thanks, Rachel. So thank you so much for all of your feedback. I think it was really, really helpful to get across this quarterly meeting and all of your insights, because it really helps us understand what are the needs within the community and understanding places that maybe additional drill down is helpful. And also we'd love your support around this survey. So just a little bit of the next steps. We're hoping to consolidate all this feedback. We also consolidated the feedback we got from our quarterly presentation. And the next step is to be able to put together some actionable, measurable measures, and that's in that March to April timeline. Also giving the Alliance back this list of surveyed data sources so you can know what's available within the Alliance, as well as different data sources that might be able to answer those questions that you all have talked about, and then creating that dashboard for you all. So we are excited to get moving on this, and thank you so much for your insights. And if you have any questions or you have additional people we should talk to or ways that we could collaborate in understanding that, please give us an outreach. You can outreach our team at rpi@civic.org. We can also put in our email addresses individually as well if you wanted to give us some insights, or if you have any questions about the survey, we'd love to get your feedback on that as well. And thanks so much for inviting us to participate today. It has been such a pleasure to talk with all of you.
Thank you. Thanks, Darcy. Thanks, Rachel. Thanks, Mega. I think that we really appreciated your time and your energy, and thanks everybody for participating and be part of this conversation. I think this is going to be really valuable for our region and counties, and we're excited to see where it's going to go. And stay involved. We will be sending out notes and information, and if questions come up, let us know, and we'll make sure they get answered. And I just wanna say thank you. Anything else, Namrata, that I missed to close out?
No, you're good. Thank you.
Okay.
Thank you very much.
Yeah, have a great one, everybody. Have a great afternoon, and we'll see you soon.
Thank you.